Hi everybody, welcome back to the Dr. Sia channel and the What's the Diagnosis series we have here on the channel. In this video, we're going to be working together with Anna. Now, if you haven't seen any of these videos before, please make sure that you practice the other ones a little bit because these videos are getting progressively more difficult as the playlist moves on. So just give the other ones a go before you give this one a go. No spoilers, let's get started. Anna, what are the problems you've been having?
I'm Sophia.
Okay, yeah, Sophia, sorry, I got that name wrong. Sophia, what are the problems that you've been having?
I don't have any problems. They just sent me here for some reason.
Okay, yeah, who sent you here for some reason?
The others.
The others sent you here for some reason? So you said this is that your doctors or other people have sent you here for no reason?
There's Chris and Rose.
Chris and Rose sent you here for no reason? Okay, and who are Chris and Rose?
The others.
The others, okay. And are those other people, are they outside of you or are they people in your life?
They're part of me.
Okay. What do you notice happening within you here right now as we're talking about this?
Nothing.
Okay, Sophia, I just noticed that you're...
I'm Chris.
Chris?
Chris.
Right, yeah. Hi, Chris.
How are you?
Yeah, I'm good, thank you. How are you?
Fine.
Yeah? Well, why are you here, Chris?
I'm so bored. Can we play?
Yeah?
Do you have a pen? Like, can we play like noughts and crosses? Or do you have an iPad? Can we play?
No, I don't have those
What
things.
about what is it? What is this? What are you growing in here?
This is just plants.
Oh, what?
Chris? This is just plants, Chris.
Rose. Like
to meet
this
you,
is
Rose.
so boring. You need like color on your walls. Can we paint?
We can definitely paint
Can we
later.
paint?
That
Can we
sounds like
paint
a really
now?
great- No.
Can we paint now? I want to paint and I want to play.
Okay. Rose,
Get some toys in the corner.
there are toys in the corner. Let's just settle down a little bit. I have a question to ask you, all right? I'm just wondering a little bit here, Rose. Just before, I was talking to... Sophia. Right. Okay. Now, Sophia, I just have a question to ask you there. Just this moment, just before, I was here with another person, it seems. Do you remember that? Do you remember just moments just before this? It doesn't seem like you do.
No. Who was it?
I met this person called Chris. Okay. And who is...
This is Chris.
Okay. This is Chris. Chris, just moments before, I was talking to somebody else. Do you remember that?
Nope.
No. Okay. All right. Yeah, I was just wondering. I was just thinking to myself, okay. All right. Yeah. And what do you notice happening within you right now, Chris, as we're sort of sitting here? What kind of problems do you have that you want to work on?
I have no problem when anyone just, mate.
Yeah?
I don't even want to be here.
No, you don't even want to be here.
I don't want to be here. I got things to do at home. I got a leaky tap.
Yep.
I got some gardening to finish.
Yep.
Can we just wrap this up?
Okay, I get a sense that you're really not wanting to be here. You got things to do.
I got things to do, mate.
And
like,
how do you imagine it ended
what are
up
you
here?
doing sitting in that chair, like all prissy? Like, come on. You don't have a day job?
Well, this is my day job. My day job is to be here and talk to you, Chris.
I'm so bored.
Oh.
You're so boring. Come on, let's go play. I saw there's toys there,
There
and
are
we can
toys
we
there.
can paint.
And those toys are for children.
Yes.
Rose? Yeah.
I'm 5.
Yeah. You're 5 years old?
I'm 5.
Yeah, okay.
Yeah, I'm in prep.
You're in prep?
Yes,
What's
and
that like?
It's so good. I have all these friends.
Uh-huh.
Some days it's sad because they're not my friends.
Okay.
But I like it.
I'm just wondering, there's a person that I think I would very much like to talk to right now. I don't know if you know her. You might not, but I know her as Sophia.
Oh yeah, she's mummy.
Okay.
She's mummy.
Do you think we could talk to her right now?
Okay. Hang on. Mummy.
Okay. Sophia.
Hi.
Hi. All right.
I'm back.
You're back. I see what you mean.
Yes.
Yeah. All right. I got to meet Chris and Rose there.
They're my little babies.
Yeah, they're your little babies.
They're my little babies.
And it seems like Rose is very much aware that you're her mother.
Yes.
Yeah. Chris doesn't seem to know much.
Chris is just... He's a man.
He's a man.
He's a man. Yes.
Typical man.
Typical, like,
Right.
like my grandfather man,
Right.
Bloke,
Right.
man,
Right.
no deodorant, working the farm,
Yeah.
and, he's the provider.
Okay.
Yeah?
All right.
He's the provider.
Yeah. And Sophia, it sounds to me like what you might be experiencing is
I'm going to tell you.
okay.
Multiple personality disorder. My other psychiatrist has told me this,
Okay.
but I don't think so because
Okay.
I've got it under control.
I understand.
I've got control.
I understand. Control over.
Chris and Rose.
Chris and Rose.
They're very sensitive.
They're sensitive.
We can't hurt them.
It seems to me like Rose is allowed to know about you.
Yes.
But I wonder if Rose knows about Chris.
Oh no.
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 No. Okay. No.
That'd be too scary.
That'd be too scary.
Too
okay.
scary.
Yeah. All right. Okay. But you know all of them, and Rose obviously knows about you too.
Yes.
Yeah, seems like
I
she's
protect her.
Okay.
I'm her mum.
Well, do you think that it might be useful for us to get Chris and Rose to know each other a little bit very slowly over time, or no? Or do you think that maybe that can't happen?
I don't know, Doctor. Maybe it's time. Maybe you can help me. We can help all of us.
Okay, yeah. All right, so that was our session with Anna. Now, I don't think that any of you are oblivious to what was going on there for Anna. The person who came in acting, doing this with me, Sophie, and I really tried to make sure that we're true to what I saw when I worked the last time with a dissociative identity disorder, so that it's as true as possible to the shifting that was happening, to the shifting in persons. Now, it was a little bit tricky how I was actually going to talk to her about that. And in reality, I wouldn't come out and say, all right, it sounds like you have multiple persons. And I didn't need to in this video here either. So we're a little bit tricky around how we worked around that. But it was true, and it very much is true, that often there is part of the person that is more willing to accept and more willing to see and to take care of the other identities. Now, I've talked to many people about this before and said I didn't really believe in dissociative identity disorder. I really didn't think that it was something that I would ever see in my practice. And the way that I learned it, it was just something that was made up and was never going to happen outside of Hollywood. But until it actually happened. And then, well, that's the way it looked. It looked just like that, you know. So what do we do when we discover that? Well, one of the most important things to keep an eye on is to make sure you really quickly want to see how much the identities actually know about each other as an indication of where the person is at this point in time. You want to understand the function that each of them has. You want to understand how each of them act to somehow protect the person inside. So you notice that for Anna, she's actually come quite a long way, because Sophia, the mother, was very much aware of Chris, very much aware of Rose, and even quite hopeful that she might be able to help Anna out. So she's gotten a lot of good help along the way. It seems like the personalities or the identity is less fragmented at the point that she comes to therapy. Now, I could talk about dissociative identity disorder forever. I consider myself a little bit of a dissociative identity disorder file where I'm very interested in it and very curious about it. If you want to know more about it as well, please don't hesitate to put some comments down below. Let me know what you want to know about. I'm happy to make videos, maybe even info videos about dissociative identity disorder as well. I hope you liked. I hope you enjoyed. Please subscribe. Please press that bell button so you get updates when my new videos come up. And I'll see you soon.